Hello, my name is Emily McKee, and I will be presenting the project on Erikson's theory of modeling and role modeling. My partners are Catherine Inman, Haley Meyer, and Naomi Wilson. We really hope you enjoy our presentation, and thank you so much for listening today. This first part of the presentation, we're going to be talking about Dr. Erikson's background and her accomplishments. This is Naomi's part of the presentation, so we're going to go ahead and get started on that. But these accomplishments are really essential to examine just so that way we can see how Dr. Erikson contributed to the nursing practice as a whole, and the nursing profession as a whole. She was born in 1936 and she is still alive today, living in Texas. She was inspired to become a nurse by her aunt when she was a child, and something we'll discuss a little bit later is that she was inspired by other people in her family as well. She earned her graduate degree from the University of Michigan at Ann Arbor in the 1970s, and after that point, she continued to contribute to academia. She did not only grow herself, but she contributed to the nursing profession and helped educate other nurses. She was an Associate Dean of Academic Affairs at the University of South Carolina, and she was awarded Professor Emeritus status at the University of Texas at Austin when she retired in 1977. So clearly she made an impact at that university. She was the first president of the Society for the Advancement of Modeling and Role Modeling. And she was a nurse educator and taught holistic nursing at 3 universities: the University of Michigan, the University of South Carolina, and the University of Texas at Austin. So as she became a professor, she not only contributed to other nurses' careers and contributed to their view of nursing, but she did it across the country, which really allowed nurses across the nation to grow their profession, which is such an important part, especially during that time of rapid growth and change and the development of new theories and developing theories. So we're going to continue to talk about Dr. Erikson's accomplishments. There are so many, and like I said before, it's really important to examine them so we can really see how she contributed to the nursing profession. She conducted several research projects during the course of her career, and as you will see throughout this presentation, Dr. Erikson really got behind the idea of holism and made sure that other nurses knew about it as well, because she knew that a person is more than just their sickness, but is made of multiple parts. She was the chair of the American Holistic Nurses Credentialing Corporation, the AHNCC, and under her leadership, she was able to strengthen their values and their commitment to their values in regards to holistic nursing practice. So they were able to continue to pursue the idea of holistic nursing. And her model was taught in curricula nationwide. So her ideas and her concept of caring for patients was something that appealed to nurses across the country. And she was awarded the Holistic Nurse of the Year in 2012 for furthering the practice of holistic nursing and bringing caring and healing to the forefront of nursing practice. So if you really think about the kind of nurse that you are, there's a solid chance that Dr. Erikson's theory contributed to the education, contributed to the ideas that you received during your nursing education. We're going to transition here into the origin and evolution of the theory, and Dr. Erikson's theory is the modeling and role modeling theory of nursing. And the first idea was initially started during her time in Ann Arbor when she was earning her graduate degree. She met Evelyn Tomlin, and then they brought on Mary Ann Swain later on, and they published their book, Modeling and Role Modeling, A Theory and Paradigm for Nursing. And it was used at the University of Michigan initially, and then it was incorporated into hospital units and used as master theses as well. So it really caught like wildfire, and then continued to be used, and then obviously, as we discussed before, moved across the country. And she edited other books as well. So she edited Exploring the Interface Between the Philosophy and Discipline of Holistic Nursing. So she not only created models and theories, but she helped other authors as well really promote this idea of holism in nursing practice. So, as we're talking about the origin and evolution of Dr. Erikson's theory, we're going to look a little bit at what influenced her theory. And she drew on concepts from Piaget's theory of cognitive development, Maslow's theory of hierarchy of needs and motivation for human behavior. That's something I'm sure we're all very familiar with. She drew on Erikson's theory of psychosocial stages, which is also something I know I remember learning about in nursing school. And then Cellier's and Lazarus's general adaptation syndrome. So she used a lot of theories from other fields, completely not necessarily unrelated to nursing, but in other fields of science, and brought them all together to support the idea of holism. And while she was earning her master's degree, she was influenced and reaffirmed by Cellier's comment, important discoveries made in life are obvious once discovered. And this encouraged her to expand and unfold her consciousness. So she was inspired to grow herself as a nurse, which contributed to her contributing to the nursing profession as a whole. As I mentioned before, she was also influenced by her family. She was influenced by her son, who asked her a question one day, which caused her to ask herself a question. Is myself a reflection of what I think and do, or does what I think and do determine the nature of myself? Do we think about different things when we focus on ourselves versus ourself? What is the reason for being here? What is the purpose of my life? And that is extremely deep, but that deep thought really triggered her to move towards research and development and really viewing the depths of humans. The modeling and role modeling paradigm was also influenced by her father in law, and he guided her to model the client's world and plan strategies within the context that maintains the uniqueness of the client. So, really, he influenced her to deliver patient-centered care and really look at a person and their potential and help them reach that. And that is what Dr. Erikson believes is the nurse's responsibility, and we will discuss that a little bit later as well. So now we are getting into the nitty-gritty of Dr. Erikson's theory, and this is Haley's part of the presentation, so we have transitioned over now. So, as we discussed before, Dr. Erikson was inspired by the works of Maslow, Bowlby, Erikson, Engel, and Cellier. Helen Erikson sought to create a theory that would view the patient in a holistic manner and that placed emphasis on the patient's perceptions, developmental tasks, strengths, and virtues. She created a highly individualized model, an aspect that is personalized to each patient based off their perception of health, worldview, strengths, and goals. It is the aim of the theory to form a trusting nurse-patient relationship, create a positive mindset for the client, cognizant of their own strengths and weaknesses, and to set and meet goals identified by the patient. And as we talk a little bit more about this theory helps nurses care for their patients by recognizing each individual's uniqueness and focuses on their needs. And it encourages patients to perform self-care and almost take accountability for their health in a way that allows them to reach their goals that they work out with the nurse. Erikson's modeling and role modeling theory is based off a number of philosophical assumptions and theoretical underpinnings. First, we're going to look at the philosophical assumptions and constructs of this theory. And these include holism, affiliated individuation, need satisfaction, growth and development, internal and external resources, modeling, role modeling, self-care knowledge, self-care resources, and self-care actions. And we will examine each of these constructs as we continue on through the presentation. The first one we will discuss is holism, and holism views the patient as a whole, including the cognitive, biophysical, social, and psychological subsystems that make them who they are. These subsystems contribute to the patient's personal worldview, perceptions of situations, and perception of health. It is important to note that health is defined by the patient's perceived concept of health. It is not necessarily the absence of disease unless defined so by the patient. Next, we're going to talk about affiliated individuation. Affiliated individuation is defined by Erikson as the need to be dependent on support systems while simultaneously maintaining independence from these support systems. Affiliated individuation can change over time, from being an infant dependent on their parents to a child exploring their environment independently while also being reliant on their parents, to an elderly adult that is dependent on the care of others. Next is need satisfaction, growth, and development. Need satisfaction, growth, and development refers to the continual needs of individuals. To achieve growth, needs and developmental tasks must be achieved. As stated in the text, when individuals are given necessary information, adequate emotional support, and are empowered in making satisfactory decisions, growth and subsequent development occur and health is enhanced. Internal and external resources. Internal and external resources are the particular resources that help an individual to cope with everyday life stressors. Internal resources refer to resources that the patient has, such as positive attitude and ability to adapt and perception of self. External resources include family, friends, and any other support system present in the patient's life. Modeling refers to the nurse's attempt to understand the patient's perceived view of the world. Role modeling follows the modeling stage and is where the nurse implements interventions that are mindful of the patient's perceptions and views. Interventions are planned that do the following. They identify mutual nurse-client goals, promote client strengths, control, and positive orientation, and build trust between the patient and the nurse. Self-care knowledge, resources, and actions are aspects that guide a patient's state of health and growth and development. Self-care knowledge refers to the patient's own knowledge of their health situation and what they perceive are the actions needed to promote their health status. Self-care resources include both internal and external resources, such as a positive self-image and a strong family support system. Self-care action is the utilization of both self-care knowledge and self-care resources to promote the patient's overall health. Theoretical underpinnings of Erikson's modeling and role modeling theory include need satisfaction, growth and development, unmet needs as stressors and stress responses, stress response states, arousal and impoverishment, and adaptation, attachment objects, loss, and grief response. Needs must be met for growth and development to be met. There are various levels to needs, such as inherent needs, which are imperative for survival, growth needs, and self-actualization needs. Higher level needs create tension and desire for additional growth experiences. Needs that are unable to be met are called stressors, which can then produce stress responses. To efficiently handle stress, individuals need adequate internal and external resources. Additionally, response to stressors is impacted by the patient's physiological, emotional, cognitive, and spiritual subsystems. There are two different responses to stress: arousal and impoverishment. According to Erikson's theory, if the patient is adequately able to adapt to stress through their resources, arousal results. If the patient is not able to adapt to the stress and lacks adequate resources, then impoverishment occurs. Adaptation is what occurs when needs are met, stress responses are low, and new resources are built. Attachment objects are objects that repeatedly meet patient needs. Once attachment has occurred, loss of these objects will result in feelings of loss, whether perceived or threatened. Response to grief in the grief process is impacted by the patient's available resources. If resources prove inadequate, morbid grief can occur and affect future developmental processes. We're now going to look at implementing Dr. Erikson's theory and what that looks like in nursing practice. Implementation of the theory consists of two stages: data aggregation and interpretation, and data integration and analysis. The first stage consists of gathering data on our patients. To gather data, we look for primary data, which would be things like what the patient tells us, very subjective. Secondary data, which is information provided from family members or friends, people who are close to the patient. And tertiary data, which is information from the medical record, doctors, and other healthcare professionals. Once all three levels of data are obtained, the nurse must assess for both the immediate and long-term expectations to properly set goals. Also important to consider are the resources the patient has available, both internally and externally. We have to ask ourselves, what strengths does the patient have? How adaptive are they to situations? And what support systems do they have in place? After these questions are asked and answered, a thorough assessment is made, and mutual goals for the present and future can now be set for the patient. Following goal setting, the next stage of data integration and analysis begins. The nurse then assesses their perception of the situation, identifies diminished resources, and strategizes a plan for remediation of deficient components. As stated in the textbook, the aim of MRM nursing interventions is to build trust, affirm and promote client strengths, promote positive orientation, facilitate perceived control, and set health-directed mutual goals. Intervention should be patient-focused and include the patient's assessment of their self-care knowledge. As this process occurs, the nurse can then confirm accurate knowledge and re-educate the patient on any deficient topics. One of the most important aspects of Erikson's model is promoting a relationship where the patient feels supported, accepted, and is able to fully trust their nurse. The nurse in this model should promote the view of unconditional acceptance and promote a sense of positive orientation in the client. As you can see, this theory is based on working with the client to help them reach goals that gets them to where they want to be. After discussing what it looks like to implement this theory into practice, we must take a look at it and evaluate it. The interventions previously discussed are aimed at helping the client achieve an optimal state of perceived health and contentment. And this can be especially difficult because as a nurse, we know that patients can be healthier, but as long as they perceive that they're healthy, that's the point of this theory. And after the client's world has been modeled, the nurse facilitates and nurtures the individual in attaining, maintaining, and or promoting health through purposeful intervention. So we sit down with them and we make goals out, we make health goals out with them, and then we educate them on how to reach those goals to get them where they want to be. So we need to, as nurses, identify mutual nurse-client goals, promote strengths, control, and positive orientation, and we need to build trust. So the nurse-client goals allow us to educate, but also kind of flows into the next bullet point of promoting client strengths, control, and positive orientation. So we give them control and accountability over their own health, and we encourage them to pursue health, and educating them on what that looks like. But most importantly, we have to build trust with them. They have to know we're on their team, and they have to know that we only want what's best for them, and we only want them to be as healthy as they can be and as healthy as they want to be. The theory states that the roles of the nurse and roles of nursing are facilitation, nurturance, and unconditional acceptance. We must facilitate healing and growth. We must nurture healing and growth. And we must accept our patients unconditionally. We must accept their goals, and we have to remove our bias. And that is something that can be really, really challenging. So, but we'll talk about the cons just a little bit later. But the unconditional acceptance goes back to building the trust for the patient. And the 5 goals of the theory, like I just said, are to build trust, and we want to promote the client's positive orientation. We want to promote client's control, affirm and promote client strengths, and set mutual health-directed goals. And this seems to kind of be repeated, but it is so important. So building that trust obviously means that the patient knows that you have their best interests at heart. We want to promote their positive orientation. So we want them to think positively about being healthy. We want them to think positively about getting healthy. We want to give them control and accountability. Control oftentimes allows people to be more motivated to be accountable for their health. Affirm and promote client strengths. Point out their strengths to your client. Point out what benefits they will have if they use their gifts and use their strengths. And that kind of flows into promoting control, allowing a patient to use the resources that they have to get to a point where they want to be. And setting those mutual health-directed goals. Obviously, we can't give them advice on boyfriend-girlfriend relationships, but we can help them keep from getting too much fluid on their lungs. We can help them lose weight and keep weight off, etc., etc. So I touched on it a little bit before. The cons of this theory are the process is defined by the relationship to the client. So first impressions are always key, and that can be very challenging for a nurse, especially if personalities don't mesh well. And something else that can be really challenging for a nurse is the nurse must be able to see the client's perspective. And it can be very, very difficult, especially if the client and the patient are not from our culture, or are racist, or may not have the same religion as we are. That can be a really big challenge for the nurse, and so that requires a nurse to carry a lot of grace for patients. And the client must be motivated to better themselves. I know personally I've had a lot of patients who they want to get better, but they're not willing to be compliant with therapy, and that can be really frustrating, and that can make it very, very difficult to implement this theory, because this theory discusses a lot about really encouraging patients to be in control of their own health. And if they choose not to be, then that is also something that the stressors can overcome the patient. We now must finally, in this last little bit, apply this theory to current nursing practice. And the nurse brings their whole self into this interpersonal relationship and continues for the duration of the relationship. The nurse can't just not be in a relationship with the patient, and so it is a continual and therapeutic process, and it's acting and reacting. It's being proactive and reactive with your patients, because every situation can be a little bit different, and oftentimes people can slightly be a little unpredictable. But there is a more formal aspect of the nursing process, and that is using those assessment skills and taking in everything that you observe about the patient, that you hear about the patient, and then using what you hear and observe and assess, and using it to the good of the patient. And we must focus on our patient and focus on the goals as well. And that's something I know I see in my practice, and I'm sure all of you all do as well. I would like to thank you all so much for listening to this presentation. I hope you enjoyed it, and you all have a great, wonderful, and blessed rest of your day. Thanks so much.